Yes, good morning, good afternoon, and good evening from wherever you're watching me from. I go by the name Nandi Empress in my YouTube channel. Kindly, guys, subscribe so that I can take you through our village life. Yes, today I want to take you through what I do when I'm not socializing. Yes, I'm a healthcare worker. I coordinate tuberculosis activities in the village. Yes, this is my office, guys. See what we do here. I want to show you patient pathways until the patient gets cured. Follow me, guys. I want to show you some tools that we use in our chest clinic. Follow me, guys. Okay, let me start. Yeah, when a patient walks into a facility, triaging takes place. A patient is shown where to go. If a patient comes with signs of cough, chest pains, or something indicating tuberculosis, the patient is referred to a clinician. There is a clinician who will see this patient and actually take care of that patient. The questions that are normally asked are you coughing? Do you have any night sweats? How long is the duration of cough? Do you have difficulty in breathing? Or do you have any person taking tuberculosis in your home? And if all these questions are yes, are those people treated? Are those people living with you in the same house or in the same school? Of course, a patient will be asked several questions. And after that, a patient will be given a sputum mag. A sputum mag is something that a patient will be given to produce sputum. Yes, look at this. This is called a falcon tube. A patient is normally told to go and produce sputum. Sputum this patient will be instructed to give about 10 mils of sputum. This one will be used for testing. A patient will be referred to a laboratory. When a patient goes to the laboratory, the patient will be welcomed by the laboratory technician. This technician will take the patient's specimen. The technician will either run it for a gene expert, a test called a gene expert, or sputum for microscopy. Yes, when a patient is told to do sputum for microscopy, a patient will be advised to remove two specimens. There's one specimen called spot sputum. That is when a patient walks in. A patient will be given a sputum mag to go and put the sputum. And then a patient will also be told to bring another one in the morning. So when microscopy is done, two sputum is required, spot and morning. And when a test called gene expert is going to be run, a patient will be told to go put the sputum in a falcon tube, and then it's only one specimen that is required. Yes, in the village where I work, we don't have a gene expert machine. We have to refer or transport sputum to another higher facility, almost 60 kilometers away. But we have riders who do that. Yes, when a patient has been tested and a patient has tested positive, a patient will now be referred to my clinic. And this is how I do it. When a patient walks to my clinic, the first thing, if the patient is coughing, I'll give a mask. I'll give a patient a mask to prevent infection. As you know, tuberculosis is spread through coughs or it's an airborne disease. Yes, you'll give a patient a mask to cover, and then also me, I'll also cover my mouth or my nose so that I don't inhale the bacilli. Yes, a patient will sit down and then we'll have a small talk. The few questions that I'll ask a patient is this. Well, what is your name? Where do you come from? Which is your nearby, which is your nearby area? And give me your phone number. Of course, I'll be asking questions while filling this card. Look at this card. It's called a TB5 card. All patient details will be put here. This card has so many things, will capture so many things. If the patient has ever been infected with HIV or any other infection, it will be put here. So when a patient walks in, I'll cancel the patient. Tell the patient the duration of medication. Of course, the medication of TB is normally 6 months. We normally do 2 months of initial phase and then 4 months of continuation phase. Yes, this patient, after counseling, I'll refer this patient to go for HIV testing. It's good also, you see, HIV is an opportunistic infection. When someone has tuberculosis, of course, if you are infected, that is the time the disease will start flaring up. So, after taking the HIV test, a patient will walk back to me. Yes, I have taken all the patient details in the TB5 register. I'll now come here, get my TB4 register. This is where I use to record all my patients. When a patient now walks in, I record this patient here. It's called a TB4 register or a tracker register. Yes, in this register, it has so many columns. The first column will be the serial number, of course, at the date that the patient came, and then the date, the serial number that will be given by the TB coordinator. That is where I come in and give them a serial number. Yes, since I work in a wide area, I have to give them number by number until the end of the year. Yes, when a patient comes, of course, I'll take all the details. And remember, we've said a patient takes 6 months to complete treatment. When a patient will have completed 6 months of treatment, of course, this patient will be released to go home. Remember, these 2 months will be issuing drugs for 1 week every now and then. Of course, it will be a weekly drug collection. When it comes to the second month, this patient will be given for for 4 good months. These 4 months will be given 2 weekly drug collection. Yes, after the end of completion of treatment, even before the completion, we'll also try to cancel in terms of nutrition. We'll give vitamin A, we'll give pyridoxine. These are drugs that will assist the patient to counter some infection or some reactions from the drugs. So we give them these drugs accompanied by the TB drugs. So we are done with this tool. This is TB4. Yes, after TB4, those who are found to be positive, the sputum was positive, we will look for the community health practitioners who will come around, and then this is the register that we record them. It is called TB contact. This community health practitioner will go to the community, to the household where this patient came from, and then try to screen everyone who lives in that community, someone who lives in that homestead. And then we have another register by the name something TB register. Look at this, guys. This is a register whereby we record each and everybody who is presumed to have tuberculosis. Yes, when these patients are recorded here, the patients will be sent to the lab, as we said, and then after the lab, the patient will come to the TB4 register, and then from the TB4 register, we are now going to the TB contact management register. In this register is normally used by the community health practitioners. Yes, these are the people who go to the community, to go and screen patients' households. What I mean is to go screen people staying with the patient, especially the children, the caregivers, and everyone who normally lives in that homestead. When they come back, they register the patient as an index person, and then they also record all the contacts of the patient. Among these patients who will be brought here, there are some who will be given preventive therapy, there are some who will be cancelled, and there are some who will be put on medication. So those who will be put on preventive therapy, we have different medication for them. And for those who will be cancelled, will be sent to the nutritionist and then a counselor. And then for those who will start drugs, we'll still bring them back on board, get a TB5 card for them, put them in a TB register, and continue with medication. This other register is normally used by the TB linkage assistant. This TB linkage assistant will work from one department to another collecting data and also giving mentorship to the healthcare workers. Of course, by the end of the month, we want data from all the departments, and this is where it's recorded. After all that is done, now, as I said, I'm the TB coordinator. I will come with my system. This is called Tibo. Of course, this tablet has an app called Tibo. Tibo is used by the TB program. So I'll come in and register the patient. I'll also register the contacts. And then also I'll register data coming from the active case finding. Otherwise, this is my day-to-day activities. I want to show you the drugs that we use to treat tuberculosis. Look at this. This is called Stop TB Kit. Yes, when you look at it closely, you'll find that it has two different boxes in it in this one box. Look at this. Look at this box. Look at this box. It's two boxes in one. Like we said, for one to complete TB treatment, you have to take it for 6 good months without failure or without stopping the drugs. Yes, when you see these boxes, one is meant for 2 months and another one for 4 months. Yes, the reason to why we have 2 months and 4 months is the drug combination. For 2 months, we have about 4 drugs combined in one. Yes, in this box, we have about 4 drugs combined in one tablet. That is rifampicin, isoniazid, iridoxine, and ethambutol. Yes, this is used for the first 2 months, followed by another one for 4 months. Initially, I told you this is for 2 months, but then a patient will be told to come on a weekly basis to collect. The reason to why a patient comes to collect these drugs on a weekly basis is because we are trying to monitor the side effects and to monitor whether the patient is taking it correctly. Otherwise, we can do it on a weekly basis. This one comes in the next continuation phase. Continuation phase will take 4 months, and in it there are drugs. Of course, the drugs are smaller in size as compared to the initial phase. This one has a combination of 2 drugs. The drugs is rifampicin and isoniazid. Yes, this is a complete package for a patient. And before you start any medication, your weight will be taken. And it's the weight that determines the number of drugs that someone takes. Yes, for instance, look at the initial phase. These are the drugs. But then the number of weight determines the number of drugs that you will take on a daily basis. Some people will take 4 drugs per day, others will take 3, others will take 2, others will take 1, depending on the body weight. This is the adult dose. Yes, we also have pediatric doses, but then we'll get into that. Yes, a patient will be given this package, but the package will remain in the hospital. The only thing that the patient will do is always come, pick the drug on the scheduled date. When a patient will be going home during the initiation of drugs, a patient will be given an appointment card. In this appointment card, a patient will be indicating the days that the patient will be required to come back for the drugs. If a patient started on 20th, of course, we'll record here 20th of March 2024. And then the patient will be coming on a weekly basis until the time that the patient will be advised that you can be coming on a 2 weekly basis, and this will be recorded on this other side. This is a monitoring card. This is like an identity card, and this is a card that has a patient details, so that when a patient goes to another facility, when this card gets lost, we can easily trace the patient and bring it back. Yes, the other drugs that we'll add on top of this is pyridoxine. We said pyridoxine, most of the pyridoxine come in white, they are white in color, and pyridoxine will reduce neuritis. Most of the drugs have side effects, and so the patient tends to come with numbness. So this drug will assist to make the patient comfortable. Yes, before the patient goes, during the enrollment time, we'll give vitamin A. Vitamin A to all patients. Yes, the patient will take about 200,000 international units. Yes, and then this drug is normally given after every 6 months. Of course, the patient will clear medication in 6 months' time. So we expect the patient to maybe take the last dose of vitamin A. Yes, otherwise that is the end of our drug presentation. Otherwise, guys, don't fear to subscribe to my YouTube channel. Put thumbs up and share my channel, guys. My channel comes with the name Nandi Empress. Kindly subscribe, guys. Let's work together in this journey of the village.